I'm Thiago Morelli. I'm a periodontist here at North Carolina Implants Periodontics, and I'd like to tell a little bit of the background of my dental education that brought me here to the practice today. So it is periodontics is the main specialty that treats periodontal disease or gum disease, and then we have the other part of the specialty that takes care of aesthetics that we usually call the periodontoplastic surgeries. The most common type of procedures that we do to address aesthetics is the gum grafting procedure. So, and then there is also all the type of procedures that we do in order to achieve bone for implant placement. To place a dental implant, we have a lot of different procedures that sometimes you have to do before the dental implant is placed to allow patients to have the treatment in the most predictable way. So when I finished dental school, when I started dental school, I wanted to go initially to be an orthodontist. Like I kind of thought, well, it's nice to move teeth around and have a feeling of adding a few of those braces, wires in the mouth, and have things changed. It should be fun. And during dental school, I realized that I didn't like that at all. And as time goes, during the dental school education, I was exposed to other specialties, and the surgical specialty is what took my attention, most of my attention. And then I ended up doing internship in auto surgery for 1 year, and right after that, I basically went to implantology, which was a specialty in Brazil when I did my regional education, and I became an implantologist, like a 3-year education on that. And when I moved to the United States, like 3-4 years after I finished dental school in Brazil, I was exposed to like a big center, the University of Michigan, like a very important dental school here in the country, that basically I have the option to choose what to study. And then evaluating the different specialties in the United States, the one that is the most comparable to what I used to do in Brazil is periodontics, which is a combination of implants and also all the tissues surrounding the teeth, the gum, the bone. So that for me was what was the most interesting in terms of pursuing like my second specialty in dentistry. One of the biggest thing that make me stay here in North Carolina, especially in Raleigh, like practicing periodontics, is the fact that by living here for almost 8 years as a professor, it's a place that we decided, okay, we don't want to move out of the state. We really enjoy living in the area, especially in the Triangle area. And with the opportunity of going private practice, I was able to dedicate most of my time to patient care. And the reason for being Raleigh is because it is a place that I didn't see any practice providing this type of care. And it's also a place that we decided to live. Like my wife is still a professor at the University of North Carolina. So we have basically, like our roots are here, like our kids were born here and we're living here for a while and we really enjoy being here.